COVID-19 research at Indiana University urgently focused on ways to detect, treat, manage, and ultimately eradicate the threat of the deadly coronavirus. The IU School of Medicine, in conjunction with IU Health and Eskenazi Health, currently engaged in a number of clinical trials of possible antiviral medications and treatments to help individuals who contract a severe form of the virus. Now, with more on collaboration and how they are efforting through this process, I'm pleased to be joined by Indiana University President Michael McRobbie and the CEO of IU Health, Dennis Murphy. Gentlemen, thank you both for being with us.
My pleasure to be here virtually.
Yes, virtually indeed, via Skype. And Michael, I'll start with you. The challenges faced by Indiana University, really reinventing the way you're delivering education, keeping your massive staff and employees safe, but also continuing the work of the university. I know it's had to have been an incredible challenge.
Well, it was an enormous challenge. In 2 short weeks, we had to convert this whole massive university, multiple campuses, 100,000 students, 40,000 faculty and staff, from the traditional model of education into all online in 2 weeks. It was accomplished. It's working successfully. I mean, it's a huge tribute to our faculty and staff and to the forbearance of our students to be able to cope with this change to their lives. And all of that was achieved in the context of obviously concerns about the personal safety of all of the individual involved. And to us, there were 2 critical things. One was to ensure the safety of our faculty, staff, and students through this process. And the second was to ensure the continuity of our education enterprise and of our research enterprise at the same time.
And Mike, this is ongoing. Obviously, Mike, as you look ahead to the fall, everyone wondering what this new normal might look like and the delivery of education. Any thoughts or perspective on students coming back to campus in the fall?
I'm very optimistic that we will certainly see some students back on campus in the fall. The big question is going to be how many and under what conditions. I think it's too early to know the answers to those questions at the moment. There's an enormous amount happening out there. We have to be concerned about a recurrence of COVID-19 in the fall, as the CDC director just talked about a few days ago. And I think what we'll be working on over the next few months is exactly what that model will be. We intend to take a phased approach, Gary, to restarting the university. And certainly at the moment, we are looking at, in the very short term, how we can get our research enterprise fully functioning again and then work towards the full semester in that way.
Dennis, likewise, a huge challenge for IU Health, a massive footprint around the state, keeping employees safe, but also delivering services as well.
Yeah, you know, Gary, it's been a real challenge, but it's been great to have partnerships with IU as we go through this. Our School of Public Health has helped us think about the demand that we face. Our School of Medicine faculty, School of Nursing graduates and their faculty have been the backbone of our response to this. And thankfully, we've been able to see our employees feel like they've got an incredibly safe and effective work environment, and that we've been able to treat patients in the way that we think are appropriate. You're not seeing here in Indiana what you've seen in New York or Seattle or some other cities.
Yeah. And Dennis, I know you feel, though, you want to make sure these patient outcomes are the best possible that they can be. But I know you, as we talked off camera, you feel that the collaboration with 2 great institutions, IU Health, Indiana University, can lead to future positives on things like infant mortality and other pressing challenges for Indiana.
Yeah, you know, Gary, I think we've seen the benefit of what working together collaboratively and bringing lots of talent sets to the table to work on a very focal, important problem can do for us in a very short period of time. If you think about what we've been able to accomplish in 60 days on this topic, bringing that same effort to those really vexing public health issues in the state, I think that's our opportunity as we go forward and get this under control.
And Michael, we only have a short period of time here, about 30 seconds, but as you look again toward the fall, you're anticipating perhaps maybe some hybrid solution in terms of students on campus and the way education is going to be delivered.
Yeah, I think that's probably the most likely outcome, that we'll be de-densifying our campuses in various ways. But at the same time, we'll see an on-campus presence as well. And I must say, just if I can add to what Dennis said, I think this whole crisis has shown that it's vital to invest in public health. And I think we've learned from that just how important it is to invest in public health.
All right, some great perspective, as always, from IU President Michael McRobbie. Also, Dennis Murphy, the CEO at IU Health. Gentlemen, thank you both for joining us via Skype, and stay safe.
Thank you very much.